Our topic that we will be discussing today is Capgras Syndrome. We decided to choose this topic because it is an interesting syndrome most people aren't aware about, yet many people are starting to get diagnosed with this particular syndrome. Capgras syndrome is a psychological condition that occurs whenever a person believes that someone they know, like a family member, spouse, or friend, has been replaced by an imposter. This syndrome was first described in 1923 by a psychiatrist named Joseph Capgras. This syndrome is one of several cases that is called delusional misidentification syndrome, DMS. Although it can be found in anyone, it is mostly found in women than in men, and it can occur in acute, transient, or chronic forms.
The first case of Capgras syndrome was named and described by psychiatrist Joseph Capgras. One of his patients suffered from a severe complex mental illness with signs and symptoms that related to schizophrenia, dementia, and Alzheimer's disease. Mary, a 40-year-old woman, was referred for psychiatric evaluation after claiming many times that her 9-year-old daughter was taken and replaced by an imposter. Despite the constant reassurance from many healthcare providers and relatives, Mary continued to have many delusions about her daughter being taken and refused to believe that her daughter Sarah was truly hers. After a lot of time spent and taken on Mary's evaluation, she was then diagnosed with the disorder of Capgras syndrome.
As far as symptoms, a person with Capgras syndrome goes through many brain changes that doesn't allow them to show their true feelings. They may experience symptoms like hallucinations, which is the apparent perception of something that is not there, delusions, and an example of that would be feeling like one is being watched, having extreme anxiety, which is the feeling of nervousness and uneasiness, and finally the feeling of depression, which is overwhelming sadness and hopelessness. However, the biggest red flag is when someone starts believing that the people closest to them are imposters. Now you can imagine how frustrating and confusing this must be for the person experiencing it as well as for those around him. So it's important that those with the condition be treated with care and a lot of understanding.
Capgras syndrome is a rare psychological condition with no true root of cause. Generally, it is associated to other memory affecting diseases like Alzheimer's or dementia, but may form as a result of brain injuries. One study showed that 1/3 of all documented cases showed brain lesions were present in patients. Another theory is that Capgras syndrome could be caused by a disconnection between the visual part of the brain and the part of the brain that processes facial familiarity. In extremely rare cases, people who suffer from epilepsy may also suffer from Capgras syndrome. Research and studies are being done constantly, so scientists hopefully will one day find a true root of the disease and can treat patients properly.
Right now, research and data for those living with Capgras syndrome is limited. Therefore, there is no set treatment plan for Capgras syndrome. However, there are certain treatment options that can help alleviate certain symptoms. Most often, Capgras is associated with 3 major mental illnesses, those being dementia, Alzheimer's, and schizophrenia. Treatments include treating those illnesses first, as they can be causing Capgras syndrome. The most effective treatment as of now is putting the individual in a safe and welcoming environment. In safe and welcoming environments, most care facilities will practice validation therapy. In validation therapy, the individual's delusions are supported instead of rejected. This helps alleviate anxiety and panic in the patient.
Some interesting facts relating to Capgras include when people have this syndrome, they usually have another type of psychotic disorder along with it. This disorder can be acute or chronic depending on the patient. Many people with this syndrome also experience epilepsy. Another interesting fact about people with Capgras is that most don't attend social events at night. Sometimes relationships with others around them can be erotic and violent. These people can also sometimes see a double of themselves and do different activities, like making 2 cups of tea, one for them and one for the double. This can be scary if they don't know who the person is they are talking to. This syndrome is known as the weirdest brain disorder ever.